Good morning and welcome to World First Aid Day. My name's Michael. I'm an Australian Red Cross First Aid trainer. I'd like to thank you for taking the time to learn life-saving first aid skills and how to apply them during the current pandemic. Remember, it's always better to do something, but having first aid knowledge to apply in an emergency can make a big difference. You could save a life. Before we begin, I would like to acknowledge the traditional custodians of the land on which we meet and pay my respects to the elders past, present and emerging. How Red Cross helps overseas reflects in what we do in Australia every day. We help people cope with disasters, crisis, unite families and protect people separated by war and conflict. We also promote better health and well-being. Australian Red Cross is part of the largest humanitarian network in the world, with a local presence in just about every country in the world. So what are we doing today? I'm going to go through and just cover off some important topics of first aid, talk about the emergency number here in Australia, first aid in a pandemic, how to keep yourself safe, the basic life support using your doctor's ABCD acronym, and I'm just going to briefly demonstrate how you treat a severe bleeding, choking, and maybe just a burn at home. All right, so the Australian emergency number is 000. So you would call this for ambulance, for police, and for fire. First aid in pandemic. Now we are doing things a little bit sort of differently. It is important you either wash your hands or use hand sanitizer before you touch or apply first aid. Even better still, you should be using gloves. Gloves are the best form of personal protective equipment that you could be using, and we highly recommend you actually put a mask on before you approach your patient. If you require any additional information, you can go to health.org.au and there's a lot more detailed information about how to keep yourself safe. Okay. So our basic life support. Okay. Now we try and make things simple with first aid, and the whole idea of using a basic life support is to determine whether your patient what type of first aid your patient's going to require. So we use this acronym, okay? Doctors ABCD. The whole idea is it's meant to be simple to remember, so in a high intensity situation you can recall it. Now as I go through these steps, I'm going to repeat the first couple of steps a couple of times just so you get the idea. It's called rote learning. So you're doing it, seeing it, hearing it. You're more likely in an emergency to remember these steps. All right, so starting at the very beginning, D is for danger. We talk about 3 dangers. So danger to yourself, just be really aware, don't put yourself in danger when you're treating a patient. The second danger is to the bystanders. In a public setting, often bystanders are standing around, taking photographs, Instagram, that type of thing. So they could be spilling onto a road. You may have to get someone to get them off the road otherwise you may have additional people to treat. And the third and final danger is to the patient. If you're going to apply first aid to the patient and they're in danger, you may have to move them. All right, our next part of the acronym is response. So what we're going to do is grab our patient, give them a firm squeeze here in the shoulders. We usually get down close on both ears and ask them the question, can you hear me? Can you hear me? Open your eyes if you can hear me. Now we ask the question in both ears, in case they are deaf or have a blocked ear, and we are looking at their face to get some sort of response. So if there's no response, we then need to be calling 000. Okay? So I can go 000 and get hold of police. However, if I don't have my phone, I can make an emergency call on my phone. on anyone's phone without actually knowing their password or their PIN number. So I have an iPhone. I'm just going to repeatedly turn the on-off button 6 times, and it's going to put it into emergency mode. So this will work on all iPhones. Some of the older operating systems, you're going to have to just push the on-off button and the volume down button, and it will bring up a slider so you can make an SOS call on anyone's phone. If you have an Android phone, you can swipe to the right, it'll bring up an emergency tab, okay, where you can still complete the call. So I've called 000. Now the next most important thing is to find a defib and get a defib. Okay, there's lots around these days. Woolworths, they've just done a national rollout. At the front of every Woolies store, there is a defibrillator. Westfields have them. Every pub, club, RSL club has got a defib. So we recommend that you go find out where the nearest defib is. So in an emergency, you know exactly where it is. You could save someone's life. All right, so if I start at the beginning again, so checking for danger to myself, to the bystanders, to the patient. No danger. Check response. Can you hear me? Can you hear me? Open your eyes if you can hear me. No response. So I'm calling 000 and I've got someone to get a defib. Now I'm going to check the patient's airway. So airway is really important, okay? So you see on the slide that a head in a neutral position, the tongue is sitting on the back of the throat, okay? So when I open the mouth to check the airway, I'm only able to see to the back of the tongue. And I'm looking for some sort of obstruction. Could be food, could be chewing gum. If there's any obstruction, I'm going to do a hip and shoulder roll and roll my patient onto their side and clear that obstruction. Now I'm just going to pop down on the floor here and just demonstrate how we do that. So I've checked for danger to myself, the bystander, the patient. There's no danger. I've checked my response. Can you hear me? Can you hear me? Open your eyes if you can hear me. No response. I've called 000 and I've got a defibrillator coming. Now when I come to check the airway, I'm going to put my hand on top of the head, pistol grip, tilt their head back, have a look down into their mouth. Now just be careful if this is a stranger, particularly during the pandemic. Don't get too close, but if there is an obstruction in the airway, we're going to do a hip and shoulder roll, turn our patient onto their side, going to tilt their head back, and I'm going to remove that obstruction. So if I check the airway and the airway is clear, I now need to do a breathing check. Now, everyone is breathing, who's watching this, you're breathing fairly regularly, say 10, 15 times a minute, in, out, in, out, in, out. If your patient's gasping, having a breath every 15, 20 seconds, it's not normal breathing. If your patient's not breathing normally, this is the trigger to start doing compressions. But before we start that, we need to do a breathing check. So I'm going to get my ear, put it down close to my patient's mouth. I'm going to look across their chest to see if I can see an even chest rising and falling. And I'm going to put a hand on their diaphragm. This is the big muscle under your ribs, between your diaphragm and your chest muscles. This is what causes us to breathe. And I'm going to say these steps out loud. So I'm checking for airway, airway's clear. I'm checking for breathing, look, listen and feel, 1, 2, 3. My patient's not breathing, I'm going to start compressions. Okay. Now, during the pandemic, we are going to do 30 compressions. We usually do 2 breaths, which is the Australian Resuscitation Council's guideline. However, if this is a stranger and I don't know them, I'm going to try and pop a mask just loosely over their face. I'm wearing a mask, I'm wearing gloves, so I've adhered to the personal protective equipment guidelines. And I might just do compressions. So the heel of my hand is going to go square on the patient's chest. I can grab my fingers, pull them back, or I can grab my wrist. Arms are straight, and now I'm going to lean forward so my shoulders are directly above the patient's shoulders. I'm going to pivot from the hips, and I'm going to start compressing. Now I'm compressing at a rate of 100 to 120 compressions per minute. It is quite quick, okay? So just try and keep up to that sort of speed. Okay? Now, how far down do I push? I'm attempting to push down 1/3 the chest depth. Okay? So for every human being, regardless of whether this is a 12-year-old child or an infant, I'm pushing down 1/3 the chest depth. With an adult, we know through research, in the Australian Research Council, adults don't push hard enough on the chest. So we need to be pushing quite strongly, okay, in the centre of the chest. Maybe this is a 12-year-old kid. Maybe one hand is enough to push down 1/3 the chest. Okay. So I'm going to continue doing just compressions if this is a stranger and I don't know. All right, so while we're doing our compressions, someone has arrived with a defibrillator. Okay. Now, as I said, there's lots of defibs out there these days. I'm just going to demonstrate this one. Now, the whole idea of the defib is we want to put the pads onto our patient, and once the defibrillator detects the pads on, it's going to analyse the heart rhythm and it will tell me what to do. Okay? So I'm going to just demonstrate this one. So I'm going to turn it on and it will talk to me.
Call for help now. Remove all clothing from patient's chest.
So it's doing things in real time. So in real time, I'm going to remove the clothing. There's a little prep kit that's attached to the defib, and I need to remove the clothing I need to be at the chest. The other thing in the prep kit is a small razor. If your patient's hairy, just need to go shave, 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 shave. Don't need to shave the whole chest. We just need to get good skin to pad contact. All right, so let's turn this guy on again.
Call for help now. Remove all clothing from patient's chest.
So it allows me to do this in real time. Cut, cut, cut. So I've now removed the clothing.
Pull red handle to open bag.
So here's the bag with the pads with the red handle. I'm going to tear that open.
Look at pictures on pads.
Pull out the pads.
Peel one pad off blue plastic. Apply pad to bare skin, exactly as shown in the picture. Press pad firmly. Peel other pad off blue plastic. Apply pad to bare skin, exactly as shown in the picture.
Now, once I get the pads on, it's going to go into analysing mode. It's really important that no one's touching the patient when it goes into analysing mode. Okay? So we'll just
remove all clothes. Do not touch patient.
So we usually get our hands up.
Evaluating heart rhythm. Stand by. Preparing to shock. Everyone clear. Press flashing button. Shock delivered. Provide chest compressions and rescue breath.
So you can see defib is really simple to operate. I'll just hold up the mannequin here so you can see where the pads are. We typically put the pads top right and bottom left. Just have a good look at the pictures. Sometimes the pads just vary slightly depending on the manufacturer. All right, so we just follow those instructions from the defib and wait for an ambulance to arrive. Now I'm just going to come back up and go through some of the differences with doing CPR on an infant. I'm still going to be using my doctor's ABCD, okay, in every case. So one of the main differences with infants, we say infant is under 12 months. Their heads are much bigger than their bodies. Their bodies tend to sort of grow into their head size. Now, the issue with that is when I put the child down, okay, because their head is bigger, it often puts their chin on their chest and it blocks the airway. So you might have to put a small pad or pillow under the infant's shoulders to push those shoulders up to rotate the head back into a neutral head position. I don't want to tilt the head all the way back because the airway is still really soft, still developing. This would be closing the airway like pulling a hose, closing the airway down. So a neutral head position. So I'm going to go through my DRS again. So I'm checking for danger to myself, to the bystander, to the patient, no danger. Now when I come to check for response on an infant, I usually don't have very much muscle mass here, so I'm going to just push my thumb into the palm of their hands, just trying to get a response. Talk to them, can you hear me, can you hear me? And I can put the thumb down the sole of the foot, again, trying to get a response. If there's no response, I'm going to call 000, and I'm going to get a defib on standby. We usually don't use a defib on an infant. In some public places like public swimming pools, there are paediatric pads, not small pads, and they're ideally suited for kids between 1 and 8 years old. Okay, so moving on, I'm going to check the airway. I'll tilt the head back, just have a look down in neutral position, airway's clear, checking for breathing, look, listen and feel. 1, 2, 3, breathing's absent, so I'm going to start compressions. So I'm going to push down firmly in the centre of the chest, and I'm pushing down 1/3 the chest depth at a rate of 100 to 120 compressions per minute. Change hands, and I can use a different technique where I'm using the thumbs, put one thumb above each other, but I'm still pushing firmly down on the stone. Now, if the child starts to vomit, I can put them on their side, still have to support their head. And it just leaves one hand to try and deal with their arms and legs. Sometimes it is very difficult because they're squirming around. So another technique is to support the infant from the front of the head. Put your forearm down the trunk of the infant's body, and as I roll the infant away from them, I'm going to put my hand behind the back of their head to support their head. Okay. Put them across your body. Okay. If they are vomiting or have liquid in them, just slightly down. And now I'm going to rotate them so the back of the head is going to be supported by the crook of my elbow. This arm goes under my armpit, and I'm going to hold them firmly about 45 degrees. Now, this is what we call the baby recovery position. It's really important at this stage to monitor the infant's colour. Okay? They can change to blue colour very quickly. If that happens, I'm going to gently put the infant back down on the hard surface, and I'm continuing doing 30 compressions, 2 breaths. When I do the 2 breaths on the infant, I'm doing mouth to nose and mouth resus. During the pandemic, you can put a shield or a resus mask over the patient. If it's your own child or a child who is known to you and you don't have a mask or any PPE, you can lick your lips to create a good seal. I'm going to put my lips over their nose and mouth. So I'm doing mouth to nose and mouth resus. The amount of air I put in an infant is the amount of air that fits in my cheeks. Just 2 puffs. 1, 2. So 30 and 2, 30 and 2, 30 and 2. Okay.
A few quick questions just around CPR while we're on it, Mike.
Yes.
So question, when removing the clothing, would you leave the bra on a woman?
Okay, that's an excellent question. Ladies with bras, I do need to remove the bra. If I can't pull it over their head, I'll cut through it. Okay? Ladies with underwire bras, okay? I have a pad top right, bottom left. The shot goes from the top pad through the centre of the heart and then ricochets back again. So if it hits a lady's underwire bra, it's going to not give her the appropriate shock. You need to cut through the bra. Certainly in public spaces, we try and protect the lady's privacy by holding up towels or blankets, but I am having to cut the bra bare the chest.
Do compressions continue while you are getting the defib pads on? Obviously stopping when it tells you, but do you keep the compressions
Another
going?
really good question. Yes, while we are prepping the patient and putting the pads on, we're still doing 30 compressions and 2 breaths. Remember, the 2 breaths are optional, particularly in the pandemic. we're only stopping doing the CPR component when the defib goes into analysing.
What happens if someone accidentally touches it while it shocks?
They can get a shock, they can get electrocuted. It's usually not very severe, but what they've done is actually divert the shock to the patient, so the patient hasn't got the full shock through the centre of the heart.
Just to clarify, someone's just asking you to clarify around the breaths during the pandemic and putting the mask on first. Are we still giving breaths via mouth to mouth?
Okay, so if it is someone who is known to you, it's obviously your choice if you're going to do mouth-to-mouth resuscitation. However, if it's a stranger, particularly in a pandemic, you're going to be wearing a mask, first of all, and put a mask loosely over your patient. And no, you're not required to give the patient breaths. Just start doing your compressions, 120 compressions per minute, and wait for the defib, wait for the ambulance.
From what age do we start to use the adult size pads?
So adult size pads can be used at a fairly young age if they are the only pads available. As I mentioned before, in some public places they have paediatric pads. They're ideally suited for kids between 1 and 8 years old. Now, if I'm unsure whether I should put adult pads on, say, a child, because I've called 000, my phone is already on speaker, I'm going to get the advice of the paramedic on the end of the phone.
Someone's asked if this session counts towards a CPR certificate.
No, sorry, you've got to come in here and we've got to teach you how to do it. We'll talk about teaching towards the end of the program.
And the final question at this point, if we do not have a mask or PPE, are we obliged to do EAR?
No, your only obligation really, if you're the first aid officer in a workplace, is to just do compressions. It is your choice. Remember, the very first D in danger is danger to yourself. Don't put yourself in danger. Okay, so we're now going to talk about severe bleeding. So this is Sylvia here. She's cut herself really badly, you can see, okay, blood everywhere. Now, I've already sat Sylvia down. I've put a blanket around her, so I'm treating her for shock. Now, the first thing I'm going to do is get Sylvia's hand, and I'm going to engage her by putting pressure on the bleed herself. Okay? So while I'm doing that, while she's doing that, I'm going to go to my first aid kit, and I'm going to get a number 15 wound dressing. This is a major wound dressing. When I open that up, you can see this is quite a strong absorbent gauze pad. I'm going to slip that under her hand, and she's still applying pressure to the bleed. I'm going to grab, for this demonstration, I'm going to use a crepe bandage. They're in every first aid kit. Now remember, we're treating this injury with pressure. So as I roll it around, okay, she can take her hand off now, and we are putting strong pressure to control the bleeding. Now, if it still bleeds through the first pad, I'm going to grab a second wound dressing, and I'm going to continue to wrap that up strongly. Okay. So remember, pressure, pressure, pressure. If it bleeds through the second dressing, I'm going to remove the second dressing only. I always leave the first dressing there because it's probably started to set, probably started to coagulate, and I don't want to sort of disrupt that part of the process. Just finish up. I'm just going to tuck this under. Usually I just tape this, a little bit of tape backing in on itself. That will hold it nice and firm. Now, as a first aider, I'm always trying different things to try and help my patient. So we've applied a pressure bandage. I'm now going to suggest to my patient maybe a sling to immobilise her arm. I think it might make her more comfortable while we wait for the ambulance. So I go to my first aid kit and I'll pull out my triangular bandage. Okay. They're in every first aid kit. And you can see the part pointing down. This is what we call the apex. It's really simple. All you have to remember is the apex goes at the tip of the injured elbow. So I'm going to approach Sylvia here. Okay, there's the apex, that's an injured elbow. So I'm just going to pop it under her arm, okay, lie across her shoulder. Just going to pop her arm against her, going to pop her arm against the body, just hold it in place. Now I'm going to get this apex and tuck it into the elbow like this. Okay, so we've locked it in. Then going to fold this part over, come around the back, and I'm going to secure that to immobilise that arm while we wait for an ambulance. So you can see it's quite simple, it's quite neat. Okay, I haven't needed to use any safety pins or any additional first aid equipment. Lovely, thank you. All right, so our next emergency is choking. Okay. Now, we put choking into two different categories. Just grab my napkin here. So two categories of choking. First of all, there is what we call a partial blockage. So it might be a kid, 10 years old, he's eating his fish and chips, and he gets a fishbone caught across the top of his airway. Now I know it's a partial choke because he can still talk. And that means the air's going out of his lungs, across his larynx, and he's able to make words. Even though his breathing is laboured, or difficult to breathe, he's still able to breathe. So I'm going to encourage that patient to lean over and to cough harder, try and move that obstruction themselves without intervening. Now the more serious is what we call a total obstruction. Now I know it's a total obstruction because my patient can't talk. They can't get the air out of their lungs across their larynx, across their airway. So what I'm going to do is I'm calling 000 straight away, or I'll get someone to call 000. Going to grab my patient and support them across their chest with my forearm, hold them tightly against your body, and with the heel of my hand, I'm going to strike them firmly in between the shoulder blades in an upward motion. So I'm going to give them 5 back blows. So 1, 2, I might check, still hasn't made any difference. 3, 4, 5, still no difference. So I'm now going to manoeuvre around behind my patient. Now, in Australia and New Zealand, we don't do abdominal thrusts, but we do chest thrusts. So your heel of your hand, centre of the chest, the same position we do CPR. Going to make a fist, roll that fist so you put your thumb down, going to place that hand on top, going to lean my patient over and support myself, and I'm going to do 5 chest thrusts. So 1, 2, 3, 4, 5. Now, while I'm waiting for the ambulance, I'm alternating between 5 back blows, 5 chest thrusts, 5 back blows, 5 chest thrusts. Now, if my patient collapses before the ambulance arrives, I'm going to start doing CPR. So I'm going to start doing 30 compressions and 2 breaths. Just be careful if it's a stranger, just do your compressions. The reason why we start CPR is because your patient is unconscious and not breathing normally. And that's the trigger to start doing compressions. Now, that's adult. I'll just show you a different technique for an infant. Okay. So with the infant, I'm going to sit down, my knees are going to be together. I'm going to place the infant diagonally across my body. So with the arc of my hand, I'm going to give them 5 back blows. How hard do you hit your patient really depends on the size of the patient. It's what I call a common sense approach. So 5 back blows and 5 chest thrusts. I'm going to hold them up against my chest, something firm, and I'm going to give them 5 chest thrusts. So again, I'm alternating between back blows and chest thrusts until an ambulance arrives or till they're unconscious, not breathing normally, where I'm going to start doing CPR. Now, if you look at the screen, there is a child. She looks about 4 or 5, and you can see Mum has got her across her knee, about where the diaphragm is. Okay? They're really flexible at this age. And Mum here is using back blows, and she's also using gravity to try and remove that obstruction. So this is also a good technique. All right, moving on. The next first aid emergency is a burn. Okay? So you might be cooking at home, you've touched the stove, you've burnt yourself. Okay? So our management plan for a burn is cool running water for 20 minutes. Okay? If you're at home, you might have a first aid kit. In first aid kits is usually burn gel. You could perhaps apply some burn gel to the injury. Okay, this might give you some pain relief. And I'm going to pull out of my first aid kit a non-adherent or non-stick dressing. Not sure what it is when I flip it over. It has a clear back. I'm going to just pull this out. See, it's a little bit sort of shiny. I'm going to put that over the burn, like so, and I'm going to hold it in place with what we call micropore tape. It's a paper-based tape. Okay? And depending on your patient, whether they need further treatment perhaps for the pain. Okay. Now, everything we've discussed this morning is the information is available on the app, the Red Cross First Aid app. It's done really, really well. I highly recommend that people have it downloaded on their phone on both platforms. It's a really quick and easy guide to find out what the first aid management plan is for a whole variety of different first aid emergencies. So I highly recommend it. Everyone should have that on their phone. Now, if you want further information or you would like to come and train in first aid, okay, on the screen here you see the web address, so redcross.org.au/learner. And there's a whole variety of different courses from simple CPR all the way through to advanced resus. The Red Cross trainers are experts in providing a safe, educational and a funny environment. So if you're learning first aid in a fun environment, you're more likely to remember it in an emergency. So it's a great thing to do. I encourage everyone to come and learn first aid. It's a life skill.
Just a couple of questions for you, Mike. Yep. So in relation to using the defibrillator, a question we have is what happens if you can't shave the chest? So there's not a razor available.
You can only do your best. What we encourage people to do, we need to get good skin to head contact for it to be effective. If you can't shave the chest, it just won't be as effective. In every defibrillator, there is always a prep kit. Could be a pocket at the back, could be an envelope within the lid of the prep kit, of the defib. But with a prep kit, is always included with a defib.
And do we check for pulse or response after every 100 compressions? Or what's the rule?
Another good question. As first aiders, we don't check pulse anymore. Okay? Our indicator of whether the patient needs CPR is if they are breathing normally. So regular breathing, as I said earlier, about 10, 15 times a minute. So you're even in, out, in, out, in, out.
And in a previous course, someone said it's been suggested to them to do compressions to the beat of the song Staying Alive. Is this accurate?
Very good. The Bee Gees, fantastic. Look, it is a good rhythm. It's about 100 beats per minute, okay? Where the recommendation now from the Australian Resource Council is 100 to 120 compressions per minute. However, in saying that, if you remember Staying Alive and you keep up 100 beats tempo, that's really good. Fantastic.
If bleeding was coming through the second gauze, what were you saying we should do?
All right, so if you've applied a pressure bandage, the second dressing and it comes through, I'm going to remove the second wound dressing, replace the second wound dressing only. Always leave the first dressing there, and I will try and apply further pressure to control the bleeding.
So someone's asked a question about compressions and breaths. Are compressions more important in first aid than providing air via your mouth? Because oxygen is maintained in blood for several minutes. Given this, if it's true, and the hesitation around providing mouth to mouth due to COVID, is this compromising the approach, or is it recommended or highly unrecommended?
Okay, so the recommendation comes from the Australian Resuscitation Council. Their recommendations for CPR is 30 compressions, 2 breaths, 1/3 the chest depth at 100 to 120 compressions per minute, centre of the chest. However, with COVID, okay, if you're treating someone, a stranger, someone you don't know, there is no problem in just doing compressions. Remember, because you've used your DRS, A, B, C, we've already called an ambulance. We've already got a defibrillator there on standby. And that's for a total stranger. However, I would be recommending, if it's friends, family, someone that you know, that you be doing your 30 compressions and 2 breaths. It provides more oxygen into the patient than just doing compressions.
Couple of questions around choking. So someone's asking, if the person's quite tall and you can't really hold them, how do you support them? And then just a question around the angle for adult and child for choking.
So often I get this question, particularly ladies, they can't get their arms around the patient. So it might be a case, you might be in a restaurant or that sort of thing. There's nothing wrong with you instructing someone else to do it. Okay? Tell them what to do. Get them up against the wall perhaps and push, push, push. So this is our management plan for choking. So 5 back blows, 5 chest thrusts. Sometimes you have to be a little bit sort of creative in how to get to that stage. But remember, you're always just trying to do your best in every first aid incident.
And someone's asking, with CPR, how do you know the pressure you're applying is enough or correct?
Okay, so we are trying to, an adult and child, any human being, try to push down 1/3 the chest depth. We know the Australian Resus Council, some of their statistics show that when we're doing CPR on an adult, we don't push hard enough. The recommendation is to push hard, push hard, push hard. You have to remember your patient's unconscious, not breathing. You can't hurt them, you may just save their life.
The paper tape is called micropore. Someone's asked about that. I know it's micropore. What would be a senior first aid course at Red Cross?
So some of the more advanced courses, we might be talking about advanced resuscitation. This is where we introduce things like oxygen, Oxyviva. You've probably seen on TV, Bondi Rescue, it's squeezy bag. Okay, so that replaces us doing the 2 breaths. We're putting 100% oxygen into that squeezy bag, and we actually use a resuscitation mask. So it is a much higher level skill. You make sure that your CPR is really sort of nailed down and you're comfortable with putting defibs on.
Snake bites, please. Tell us what to do.
Right, snake bites. All right, so for all snakes, we use a technique called the pressure immobilisation technique. Okay? It's, we don't have time to demonstrate it today. If you wanted to find out more, you could jump online or you could download the app. Better still, come into Red Cross and I'll show you exactly how you actually treat a snake bite on an arm or a leg.
Someone would like you to repeat that phone alert app again, please, Mike.
Okay, so I have an iPhone, okay, iPhone XR. This could be anyone's iPhone. So all I'm going to do is repeatedly turn the on-off button 6 times. 1, 2, 3, 4, 5, 6. Sure, I'll turn it off because it will complete a call, okay. Alternatively, I can hold the on-off button and the down button, give it a squeeze, and it should pop up with a slider to make an SOS call. If you have an Android phone, you actually swipe from left to right. It'll bring up an emergency tag. I should be able to push that and it will make an emergency call. So I don't have to know the person's ID, their passcode, or their fingerprint.
Someone's asked about head bumps. Should you use a cold compress on a head bump? And if so, what do you actually define as a cold compress?
Okay, so maybe it's someone, it might be a child, they've come off their bike and maybe they've banged their head. Now, we always have to suspect there might be concussion, and the important thing is, with these type of head injuries, that we need to monitor the person for a minimum of 4 hours. It's in that 4-hour period that the signs and symptoms of concussion can present themselves. And it might be something like they might be starting to feel dizzy, the level of consciousness is changing in and out, they could become quite so nauseous. If that's the case, I would be calling an ambulance or transporting the patient to emergency so they can be checked out. I can use cold compress. In a lot of first aid kits, they have a chemical ice pack, and you just pull them out. They're all slightly different. Just read the instructions, just give it a squeeze. You should hear something snap. They're usually good for about 3 hours. You can put that directly on the skin. Okay. If I don't have that, you can just get a little lunch bag, a little Ziploc bag. You can put ice in it. But the important thing is not to put the ice directly on the skin. We usually go skin, thin cloth, tea towel, t-shirt, and then ice on the top. This actually prevents freezer burn.
Just back to the defib pads. So would you apply the defib pads if there was bleeding on the chest? And what if you don't have a defib?
Okay. So let's just address first of all, if you don't have a defib. If you don't have a defib, all you can do as a first aider, first responder, is 30 compressions, 2 breaths. Remember, you've called an ambulance, so hopefully an ambulance will be there shortly. So you're just going to continue 30 compressions, 2 breaths. Physically, it is demanding. You might have to get additional people to come and help you do the compressions. Might be 2 or 3 of you. Maybe you do 30 compressions and swap out, 30 compressions and swap out. So we're able to do high quality CPR for a lot longer. Now, in regard to the question about putting defib pads on, maybe someone has blood on their torso, but the recommendation is to make sure the skin is dry. That may not always be convenient, but you can do your best. If there's an injury, say in the top right part of the shoulder or the bottom left of the abdomen, you may consider changing the orientation of the pads. One up here on the top left, one here on the top, on the bottom right. Okay. So again, we as first aiders, first responders, we just try to do the best we can.
Someone said something is better than nothing.
Something's better than nothing. Any CPR is better than nothing.
Just back to the choking, how many rotations between 5 back blows and 5 chest thrusts and when someone is choking, and when do you decide to move to CPR?
All right, so we're going to continue with this rotation of 5 back blows, 5 chest thrusts, and I go backwards and forwards till either the ambulance arrives or till my patient collapses. If my patient's collapsing, I'm going to try and help them down onto the ground so they don't end up with a head injury, and then I'm going to start doing compressions. Just remember, the reason why we're doing compressions is because my patient's unconscious, not breathing.
And quickly, can you tell us, so is it good to offer water while a child has choked?
No, that's not the recommendation at all. Water, some of the old things used to be a dry piece of bread and that sort of thing. That's not recommended at all. So all you're going to do, if a child is partially choking, encourage them to cough, cough harder, cough harder. If you're still concerned or they can't remove that obstruction, you're either going to be going to emergency or maybe your local GP.
What if a person is coughing badly, displaying symptoms of COVID in addition to other injuries?
Okay, so I have to consider the other injuries. If you suspect they're coughing and have COVID, look, it's really up to you. Remember, the very first danger in our basic life support is danger to yourself. Maybe you don't want to get too close to them. You could ask them to put a mask on. Maybe the best thing you could be doing is keeping your distance and calling an ambulance. Okay? The key is not to put yourself in danger.
Can you tell us briefly what are the first things to do in case of a broken bone?
Okay. So, brakes. Now we put brakes into as first aid is 3 categories. We call it a closed fracture. So it may be a broken forearm, typically with kids between 9 and 14, hasn't come through the skin. You might see local swelling, localised sort of bruising. Okay? So I'm going to immobilise that limb and transport that patient or refer that patient up to an emergency or a medical centre so they can have some sort of x-ray and see what's going on. If it is a compound fracture, sometimes referred to as a green stick fracture, this is when bone is coming through the skin, can be quite bloody. The blunt force trauma to actually snap a bone like that is very strong, so there are probably going to be additional injuries. Again, this is the type of thing that we go through and we discuss in detail during your first aid training. It's difficult to summarise this in a webinar, so I recommend you come along and do some training.
Just one final question we'll need to wrap up is if someone's wearing a necklace and you have to put the defibrillator on them, is it okay just to move the necklace away or should you take it off?
Okay, so all I need to do is just move it away from the chest, okay? We usually don't have time to be trying to fiddle around and undo someone's very fine sort of necklace, so just push it to the side. So it's away from the actual chest area where we're going to put the hands.
And I'll just mention somebody has asked, because obviously we're Australian Red Cross First Aid and Mental Health, whether there's a mental health component today, and there is not today, but we may look at doing something next month during Mental Health Awareness Month, but not today. This is all about first aid, right, Mike?
It's all about first aid. However, just to support Joe, the mental health, the Red Cross mental health first aid program is fantastic, and everyone should be doing the mental health first aid, particularly with this pandemic. People are sort of isolated and that sort of thing. It does provide fantastic tools, first of all, to identify and to show you how you can actually help that person who might be suffering mental health issues during the pandemic. So I highly recommend it. It's another course you should be signing up to and doing with Australian Red Cross.